Welcoming a baby into your life is magical, but let's face it, parenting comes with a steep learning curve. One important skill for every new parent is learning how to burp your baby. In today's video, we'll explore why burping is essential, share effective techniques, and provide helpful tips for soothing your little one. First, let's answer a common question. Why should you burp your baby? When babies drink milk, whether from a bottle or breastfeeding, they often swallow air along with their milk. This air collects in their tiny stomachs and can cause discomfort or even pain if it isn't released. A burp is simply a way for that trapped air to escape. Burping not only relieves this discomfort, but also creates space in your baby's stomach. This can encourage them to drink more and get the nutrition they need. Without burping, they might feel full too quickly, missing out on vital feeding time. Several factors can lead to your baby swallowing air during feeds. For example, newborns are still learning how to coordinate drinking and breathing, which means they might gulp air between sips. An underdeveloped digestive system can also cause more gas to form, especially as they process certain nutrients. Additionally, improper latching onto the breast or bottle can allow air to sneak in. Babies who feed greedily or drink too quickly often swallow more air, especially if the bottle's nipple flow is too fast. Understanding these causes helps you anticipate when your baby might need extra help burping. Now that you know why burping is essential, let's talk about how to do it effectively. There are several techniques, and it might take some trial and error to discover what works best for your little one. First, the classic over-the-shoulder method. Hold your baby upright against your chest, with their head resting on your shoulder. Use one hand to support their bottom and the other to gently pat or rub their back. This position helps them relax and makes it easier for that burp to rise. Second, the sitting on the lap method. Sit your baby on your lap, leaning them slightly forward. Support their chest and head with one hand, placing your thumb and forefinger gently under their chin. Use your other hand to rub or pat their back. This position is especially great for smaller babies who need extra support. Lastly, the tummy on the arm technique. Lay your baby face down along your forearm, with their head supported by your hand. Let their tummy rest against your arm while you use your other hand to pat or rub their back. This method also helps with tummy comfort. Sometimes, your baby might not burp right away, and that's okay. Burps can take time, up to 30 minutes in some cases. If your baby seems comfortable and isn't showing signs of distress, they might not need to burp after every feed. If your baby falls asleep after feeding, you can still try to burp them gently using the same techniques. However, don't worry if they don't burp while asleep. They'll let you know if they're uncomfortable later. Here are a few extra tips to help minimize swallowed air and make burping easier. First, ensure your baby latches properly during breastfeeding or bottle feeding. A good latch prevents air from sneaking in. If you're using a bottle, keep the nipple full of milk by holding it upright. Stir formula instead of shaking it to avoid creating air bubbles. Warm water can also help dissolve formula more smoothly. Lastly, consider experimenting with different bottles and nipples designed to reduce air intake. Burping your baby is a small step that can make a big difference in their comfort and feeding routine. With practice, you'll find what works best for your baby and enjoy the relief of knowing they're happy and content. Don't forget to like, subscribe, and share this video with other new parents. Let us know in the comments what works for you. Happy parenting!